let's talk about it today. Some contraindicated groups in the clinic, and operating precautions, and some things we need to avoid after operation. After we assemble the machine, we will turn it on. We'll have a clinical demonstration later. I'm going to show you a male model. So here's what we're going to do. Under normal circumstances, the patient is lying flat. Because I'm here to show it for your convenience, so I let our models sit. Our clinical approach to the face. The taboo side. Especially some metal objects implanted on the face. Or electronics. And some essence has been planted on the part. Or other gel-like silicone prostheses. We do not recommend operating on this part. Children, pregnant women, and patients with localized skin diseases. It is also not recommended to use our machine, because it will affect the recovery of later wounds. And here's a few of us. It is also a relatively common operation that is not recommended for some people. Then there are the precautions for clinical operation. Let's take a look at the face. First of all, some restricted areas on the face are not allowed to be operated. The operable area of the forehead is below the hairline. To the area above the brow bone, the temple part is not allowed to be operated. The area within the orbital bone is inoperable. It can be operated beyond 1 finger width of the nose. Operation is not allowed within 1 finger width. The corner of the mouth is also 1 finger wide before it can be operated. Operation is not allowed within 1 finger width. Then this part of the jaw. I do not recommend customers to operate it. Because of this area, this triangle is denser. So very few people can withstand the energy of our machine. It is not recommended to operate these parts here. If it's this part of our ear. This side is also an area beyond a finger width that can be operated. Operation is not allowed within 1 finger width. There's the hairy area. It is not recommended to operate here. And we've got a bone here in the cheek that goes down the jawline. It is not allowed to operate. When we operate, probes can be used. That's it. Gently stagger the bone, then lift it up. Operate with techniques. The chin, including the neck, can be operated. But I suggest here. He uses a shallow probe to operate. For example, 1.5, 3.0. Try not to use 4.5. If the skin on the client's neck is thin, it's hard to beat with 4.5. This part of the throat is not allowed to operate. The middle part cannot be operated. We roughly know which areas of the face and neck can be operated on. Which ones don't work. We have the same face on the other side. Here are some of the off-limits of our face. If it is the body, abdominal fat loss or shaping. We are mainly in the belly button position. It's not allowed. It is okay to operate along the belly button. And then the humerus. This area of the lungs, it has a humerus here. This bone is inoperable. The pain of the probe hitting the bone is very strong. Then of the stomach, this area is not allowed to operate. And here are some of the areas that we don't allow for human manipulation. So we're going to demonstrate this. For example, with a single row of handles. We recommend that the operating head be from deep to shallow. Give the customer a try, because we're not sure what is the approximate depth that the customer can withstand. Generally, it starts from, for example, the head of the face is 4.5 down, 3.0, 1.5 and so on. But most customers can accept 4.5 probes. So after we install the 4.5 probe, the first is to set the energy. We start from low to high. We do not have recommended values for all customers. So when he operates, just start from low to high. Hit the body. We can ask customers, take this feeling as an ultimate clinical goal. Hit the body. It will have a slightly warm feeling. Then it will be felt on the body muscles. It feels like there are ants walking around. This is normal. It takes this feedback to make adjustments to the parameters. More energy, it causes more damage to the skin. So if we turn the energy up, after the customer's skin operation, there may be redness and swelling, or obviously redness. In severe cases, it will burn the epidermis. Therefore, the customer's energy should be controlled within a safe range as much as possible. We have shot videos before, yes. The number of clinical hair introduced in the face is between 200 to 300. Just preset the number of rounds here. Then below, if the customer wants to use EMS, we can prescribe EMS for him to work. Because EMS plus RF, after the two energies are superimposed, it's great for the face anti-aging. If the customer cannot accept the muscle training of EMS, we won't open. We can also turn on RF. It is also recommended to start from low to high, feeling warm with customer feedback, or it can feel slightly hot. Adjust the parameters with this goal. Let's not turn it too high all at once. Because of RF, it gets too hot. It burns our skin. We basically don't need to adjust its parameters. The way these two work, consecutive or single shot, this mainly depends on the customer's operation. If it is the body, continuous mode can be used. In this way, the speed and efficiency of his operation will be faster. If it is a single shot, it's relatively slow. But in the case of a novice, I personally recommend that he use a single shot one. Then we set these two modes here. Some customers will ask, which one should be used in the clinic? If the facial droop is serious, or something with deeper lines, we can use this. It's a straight line. It goes much further. So the effect is also better. You can also stack the two. That is, we operate the dotted line and then operate the straight line. On the same part, you can stack too many times. The general recommendation is less than 3 times. We click ready. We normally, it needs to be operated with gel. Well, there are two ways. One is to apply it to the window of the probe here. Then click. Start dotting. Click here to click, or use the pedal control to hit the point. After one shot, it just stops. And then we move to the next block. It's about 1 to 3 millimeters. The position move between each shot. Just follow this method. Perform a facial lift. Why is it called Tera? Because after facial aging, The skin is sagging. We follow closely. Must be close. During the operation, in a state of not sticking. Yes, it will definitely burn the skin or scald it. So we have to stick close. Especially during the work process. If you can't, just pick it up without authorization. This can easily cause skin damage. We will closely cooperate with the lift. Let's take a look. Pull hard. His face is going up. So it's pretty obvious. Release after beating. We will operate according to this method. Or we lift it by hand. Lift up the sagging skin on the face. Then do it like this. This is also a method of operation. Another kind. Just apply the gel directly to the whole face. After painting, it operates in a continuous mode. Click. Cooperate with the method of drag and drop to operate. At the moment of picking up, we're going to stop this handle. Then stick it tight. Then drag and drop. Drag and drop by starting work. The moment you pick it up, stop first and then pick it up. Remember, it must have been when picking up the probe. We have to stop and then pick it up. This way, it can be avoided during the work process. Hit the epidermis. This is what our face does with our cheeks. Usually use 4.5 or 3.0. The operation of the forehead uses 4.5. Neck manipulation using probes below 3.0. The area around the eyes, we usually use 2.0 probes or 1.5 probe. The number of operations is about by rounds. Because I just set the number of stacks, no more than 3 times. It is recommended to do it less than 3 times. So we can also operate a single row. With this 360克ahead. Perform facial reconstruction. Just follow the method we just set. After applying this mixture, operate closely with the method of circling. With this handle, the operation area will be smaller, so there are some areas that cannot be operated by a single row. This gun head can be used. Be sure to circle tightly. You can stay in one place for a long time. This is wrong, because you stayed for a long time. All the energy is concentrated in one area. This can easily cause redness and swelling in the area, or burns. After operation, remember the gel left on the probe and facial gel residue. Use a clean towel, or wipe it clean with cotton gauze. After wiping it clean, apply a moisturizing mask to the face. That's it. We need to pay attention to some matters after operation. Can't go to the sauna or do some facial massage projects. No other ultrasonic knives can be used for a week. Or EMS can operate the face again. Within a week, you can eat some overpigmented ones either, like soy sauce and some other foods. You can drink and smoke. Spicy food and seafood. Don't eat too hard food, such as sugarcane, betel nut, This kind of food is also not allowed. 1 month after operation, persistent soreness in the facial muscles is normal. And within a week, sooner or later, apply a mask to moisturize. Drink as little water as possible at night, because everyone's metabolic rate is different. Therefore, we recommend drinking less water after 8 p.m. Then care. If facial edema occurs later, even mild swelling is normal.